Hi, my name is Dan Limmer. I'm the founder of Limmer Creative. Limmer Creative creates smartphone apps for public safety and allied health personnel. One of the apps that we do is called EMT PASS, and this presentation today is going to be called 10 Things I Learned About the NREMT Exam from EMT PASS. Now, EMT PASS, you'll see on the screen, is written by Bill Brown. Bill Brown is the former executive director of the National Registry of EMTs. He has been involved personally in 100 or more item writing panels. No one understands the National Registry exam and has created an app that is any better than this app that you have before you today, EMT PASS. Now, as an educator, I have trained thousands of students between EMTs, AEMTs, paramedics, and I've tried to prepare them all very well for the National Registry. But I will tell you that this app has given me new insights. Now, just to give you a quick overview of the app, EMT PASS has almost 1,000 questions. Half of those questions have audio rationales. These rationales are by Bill Brown himself. They give insights into the questions. They give insights into the knowledge. They give insights into pathophysiology. And I think that regardless of how you learn, whether you read or whether you listen or you're some combination of the two, the challenging questions in this app and the audio rationales that are provided, over 20 hours of audio between introductory audio and the rationales that are included in almost 500 questions, I really don't believe you'll get any better preparation for the National Registry of EMTs exam. Now, this is 10 things that I learned from this. I mean, I've known some of them, but I think it really brought it home, and I want to tell you about them. This will help you for the exam. I also think it'll help you learn the value of our app, EMT PASS. All right, number 10, not all patients get oxygen. Now, a couple of years ago, no one would have thought that this ever would have been part of EMS. Our belief was that oxygen was the wonder drug, everybody gets it. Now, I know that some people are still teaching it like that, and that's wrong. That's not the way it works. That patients who have oxygen saturations of 94% or higher, especially those patients that have acute coronary syndrome, chest pain, possible MI, and the stroke patients, they're above 94%. They won't get any at all. Now, if they've got really difficult breathing, you maybe do a cannula, but that's maybe. So patients who do get oxygen often get it by cannula. So I recognize that there's a big issue out there that a lot of protocols still say give 15 liters of oxygen by non-rebreather mask, even though the current AHA guidelines say that's wrong. Now, this topic will come up many times in the rest of this presentation, but here I think is the important point. Not all patients get oxygen. That patients that are in minor distress, patients that don't have a lot of difficulty breathing, that have chest pain, signs and symptoms of stroke, you're going to use your pulse ox as kind of a guide for that. Now, you always have to follow your protocols, I understand that, but remember, on the exam, they're going to use AHA guidelines, and those are what the guidelines are. 94% and above, especially in those cardiac and stroke patients, won't get oxygen unless there's some type of severe difficulty or if you have some type of respiratory failure. We're going to talk about all those things later, but let me tell you, this was a major change for EMS. Your instructor may still be teaching giving a lot of oxygen, even though it's not going to be on the registry. It's a pretty traumatic thing for us to have to make this big change. But it's worth saying one more time, not all patients get oxygen. All right, let's go to number 9. You really need to know pathophysiology. I mean, you do need to know pathophysiology. So it was worth repeating there. You will learn in the audios that go with this, knowing what goes on inside the patient helps you understand even test questions. Subtleties that you will find on the National Registry, you will decipher, you will figure out better if you know the pathophysiology. Think of this, the way I always talk about it with my students, is that I can teach you to memorize a list of signs and symptoms. That's okay. But if I can teach you what goes on inside the body so you understand the signs and symptoms you see on the outside, that's better. And that's pathophysiology. So you really do need to pay attention to this. You need to read those chapters in your book. You need to brush up on it, and you need to know how that pathophysiology applies clinically, specifically in the airway section, which is a challenge, especially when it comes to respiration and ventilation. And you'll also need to know it as it comes to shock. And shock can occur in both medical and trauma patients. That's really where the pathophysiology brings it home and helps you understand things better. Number 8, many times the right answer isn't there. So, you walk into the computer center, and you sit down in front of the computer, and you get a couple questions. They don't seem so bad. All of a sudden, you see a question in front of you, and you see 4 choices, pardon my language in advance here, and they all suck. Or you look at them, and they all look right. You might say to yourself, boy, I'd do all of those. That's the nature of the National Registry exam questions. What you need to do is to choose the best answer. So the best answer might not be the one that you would do in the field. It might not be the one that you think is perfect. It might not be the one that you would say is correct. But it's the best of the ones given. And this is something I think that throws a lot of people off as they see these questions, and it just totally screws them up. About 70% of the people that take the National Registry pass the first time. After 2 or 3 attempts, that goes up to about 90%. Now, I personally think, and I can't say this is based on science or research, there's a couple things that cause that improvement. One, I think people don't pass and they study more. But the other thing that happens is the second time they go in, they're less freaked out. The questions don't freak them out as much because they've had that experience once before. Well, I want you to have that experience before you get to the exam. That's what this app does. This app gives you questions, I would almost venture to say, that are sometimes going to make you angry. You're going to look at those and you're going to say, what kind of question is this? All these answers are horrible. Or all these answers are right. How do I know what to do? Well, you know what you do? You make your best choice, what you think is the best answer. And then when you finish the exam, go back and listen to the audio that goes with it, and it'll explain why. Very few people have ever come out of the National Registry and said, wow, gee, that was easy and clear cut. Everybody comes out and says, that was not like any exam I've ever had in class. I believe that we've given you the experience as close as you can get to the National Registry. Now, when Bill Brown created these, he wrote each one of these questions. They are original questions. There are no National Registry items on our exam. We support the National Registry. We believe in their role as a national certification organization. We would not put an actual registry question on here. That being said, I don't believe you'll get any closer. As a matter of fact, Bill wrote these questions to some of them have them a little tougher than what you'll probably see on the exam. The concept behind that is if you can do the tougher ones, the exam will be easier. This is a program. This app is a program. It's not something that's fluffy. You go through and you do a couple study cards. This has 8 exams. And these exams are challenging, and they take some time, and the questions are going to make you scratch your head, and you will thank us for that afterwards. Number 7, your protocols may be different than what is asked on the National Registry. And we talked about that already with oxygen. It may be very different. I think oxygen is really the big one that people complain about the most. And that's where this exam is going to help you. You know, your instructor, most likely, I know a lot of instructors in EMS, a lot of educators, they're passionate, they want you to learn. Sometimes some old habits or some old things sneak through. And even in spite of the fact that the American Heart Association came out with these oxygen guidelines in 2010, it's taken a long time for us to embrace those. So remember that you are going into the exam and you are choosing the best answer with what you're given, and it does not reference your protocols. Just with 50 states in the United States, and some of those states have regional protocols, it's not unreasonable to think there's 75 or 80 or more different protocols in the United States, and the National Registry cannot match them all. So please don't be one of those people that writes us and says, this app doesn't match our protocols. It is not supposed to. The exam will not. The faster you figure that out, And I believe that that will happen by using this app. The better prepared you will be when you walk into the National Registry exam. Number 6, think less rigidly. Keep an open mind. And this goes with number 7 about the protocols. I think sometimes people's head spins around and smokes come out their ears when they get some of these questions because a lot of things that have been presented in class, things that have been presented in your book, are straightforward. When you learn things, you go through your book and there's bullet points about certain diseases, and you take your tests, and you may have a test on diabetic emergencies, then another test on altered mental status, another test on cardiac and respiratory. And they're always very clear-cut and very compartmentalized. But there are times in the field, and there are times on the exam, when a patient may have 2 problems. One question that makes people particularly angry talks about a diabetic patient who appears to be having a stroke. Can you give that patient sugar? Now, while it's well known that you don't want to give a patient having a stroke a lot of sugar, if that patient happens to be a diabetic, we must explore the diabetes. And those are the kind of things that I want you to keep an open mind about. People look at a question and they instantly lock on one particular fact that they heard in class, and that may or may not apply to the question. So I think it's very, very important to be less rigid and have an open mind when you look at these National Registry questions. Now, number 5, going in that same direction. Each question is separate from the next. One question will not relate at all to the next one. As a matter of fact, you might be given similar choices, but it's going to be different. Here's an example. You're given a call, and you have a patient, and you've done a stroke scale, and you've done some history stuff, and you've gone through and asked, what should you do? Well, if you've done a stroke scale, and if you have information from a history, maybe you have vital signs, that means you've already completed your primary assessment. So they may say, should you give oxygen? And while oxygen you might not give because of their oxygen saturation, you also won't want to give oxygen because that won't be the choice because you're in a spot in the exam where it would have already been given earlier. Now, if you took the next question that gives a similar patient, but you're in the primary assessment, you're in that primary early part of the call, well, oxygen might be a choice. There are so many variables in the question. Look at the question. Figure out what's going on. Figure out where you are in the call. Look at what's been done. And then when it says you should, a lot of the questions end with you should. It's totally dependent on what you get in that question. Now, the National Registry rarely goes more than 3 sentences, and they ask you to make big decisions based on those 3 sentences. Read it carefully and move on. And remember, it's like it says here in number 5, each question is separate from the next. Totally separate. Number 4, there's no set rules. You probably have been taught by people or told by people that you've met maybe when you're doing your ride-alongs, or you know people that are currently EMTs. They say, oh, listen, if you get stuck and you're in doubt, put on oxygen. Or if you're in doubt, scene safety. They've got all these rules. There are no set rules. The registry is written by national experts. The questions are tested. They are validated before they're put into the exam. So they are written so there's no way to tell. They are grammatically correct. They are tested. And there is no one rule that you can apply to every question. Remember what we just talked about. Each question's different from the next. So it's pretty unfair to say that always pick scene safety or always pick oxygen. Some people say always pick doing something rather than not doing something. Well, none of those are true. There are, in fact, no set rules in what we do on the exam. Number 3, differentiate between respiratory distress and respiratory failure. I think with the pathophysiology that people are learning in EMT class now, we're doing better as far as that goes. It used to be a very big problem. People were having patients, they're breathing 4 or 6 times a minute shallowly. And what are we doing? Well, we're putting non-rebreathers on. Wrong answer. Respiratory distress. The patient will probably have difficulty breathing, but they will most likely be oriented. And they have signs that their breathing is supporting life. Respiratory failure can be identified by a number of things. A respiratory rate that is very, very low or very, very fast, and signs that it might be shallow. So if someone says someone's breathing 8 times in shallow, well, you'll probably ventilate that patient. If you're giving a patient that's breathing 28 times a minute, but they appear oriented and are giving a good history, well, that might be a patient that might need oxygen by cannula. Patients in respiratory failure, the ones that are not breathing enough to support life, shallow breathing, slow breathing, and sometimes very fast breathing, often with an altered mental status indicated in the question, they need to be ventilated with a bag valve mask or a pocket face mask. That's respiratory failure, and it's vital, 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 vital that you know the difference between these two and can identify those in a test question, because what you should do will change dramatically based on your decision. This, by the way, is very important for the field as well. Now, number 2, you must study. I repeat, you must study. Now, people study different things. Now, we have our EMT PASS app, which I think is a great way to practice test questions, and you will learn a lot from that. Throughout your entire class, you should have studied. You should have read the book. You should have taken your tests seriously. And some of that study hopefully will have been done in advance. But when you study, we can read through your book, but pay attention to things like critical thinking questions you may find and things like that might be in your chapter, maybe in the chapter review at the end. I think those things are important because they're application. The National Registry very rarely, if never, asks very simple questions. The normal respiratory rate is. A sign and symptom of this is. They generally put it in a patient scenario or some type of question where you'll have to make a decision and not just do recall. Studying is vitally important. It is vitally, vitally important to remember. Number 1, time is not your enemy. So I've counted down from 10 to 1, and I wanted to leave you with this one. I thought this one was very, very important. I've talked several times in this presentation already about not freaking out. You see questions that throw you off, choose your best, make your best choice, and move on. You're not going to be able to go back. Just make the choice and move on. Do the best you can. But when you're doing that, don't rush. You have a couple hours for the exam. You're given about a minute per question. I think you'd be surprised how long that minute is. Some you're going to do in 15 or 20 seconds. So that time is on your side. Time is not your enemy. When you're starting to feel flustered, it's okay to take a breath. It's okay to look for a couple more seconds at the question and be able to pick out the important things that might cause you to make the right choice. So using that time, we believe, is vitally, vitally important. Now, I told you that these things come from EMT PASS. Like I said, I worked with Bill as we built this app. I reviewed all the questions. I argued some questions with him. We've made other video podcasts from this. Our 5 Tough Questions video, which we have up on YouTube, gets a lot of talk. Like I said, that this is the kind of test prep that is not soft and fluffy. This is hardcore preparation. This is real preparation. If you take this, we believe that you'll be the best prepared, not just because you will have learned a lot of content, but because you will have a great feel for what the test is about. There are 8 120-question exams. Half of those exams have audio rationales. So it's very important that you go through and take these seriously. This is not just a casual study app. This is a review program, and I want you to know that. It's available on the App Store for Apple. It's available for Androids on Google Play. And you can also get it from our website, which is www.lc-ready.com, and you can purchase it there. If purchased online, you can use it in your computer at home, computer at the station, and still use it on your mobile device. And that's from lcready.com. This app is called EMT PASS. If you're an educator, or if you'd like to tell your educator about this, pass on this information. Sarah McCabe is our sales manager. Sarah at limmercreative.com. Her phone number's on your screen there, 207-482-0622, extension 2, and we will give discounts and ways that this can be integrated into your classroom for even greater success. So again, my name is Dan Limmer. I gave you basically 10 things that as an educator when I went through this, and I listened to every single rationale, read every single question in here, and I said to myself, I've been preparing students for a long time, but there were some things that really jumped out at me. So this presentation gave you 10 of those things. And we, more than anything, at Limmer Creative, are here to help you succeed. Thank you.